It just seems that the amounts are indiscriminate and unrelated to the cost of the service.
After the News 5 investigators aired recent concerns about medical facility fees creeping into your bills, more patients are now raising red flags.
Facility fees can be tacked onto your medical care bills for various reasons, and people are worried just how far health systems are willing to go. News 5 investigator Jonathan Walsh following through tonight with new developments.
All right, Jonathan, people taking action after your reporting.
Yeah, well, it's a genuine concern. Some people told us they had no idea facility fees were even a thing, and they decided to do something about it, all as states across the country figure out what they're going to do next. 63-year-old Rob Schulen's retirement passion was this e-bike.
And I would go fishing, and I would stay in the area, and I would drive from here downtown Cleveland, put it on the rapid, go visit my brother on the west side.
3,000 miles later, he says he threw out his back in 2 places.
I was rushed by ambulance to the hospital because I couldn't even get out of the chair. I was just so locked up, my neck and my lower back. I would not wish that on anybody. Very painful.
He went from 2 wheels to 4, his wheelchair. He saw our recent report on medical facility fees being tacked on to patient care. He then contacted his own health insurance.
And when I called, they said, no, they're not going to cover facility fees.
He called University Hospital's billing department and says they gave him vague answers about facility fees. Concerned about that cost, he canceled his upcoming appointment.
Better call and make sure there's no facility fees, and we want transparency in our medical bills, which thus far has been lacking.
Some interesting things have happened since our report, huh? After we reported her story last month, Beth Davis says her facility fees at UH vanished.
And I saw my balance was zero, and it had been $1,580 something.
Only to find out, a week later, $500 in facility fees were put back on her account, again with little explanation.
A lot of people who have approached me since the piece aired said they weren't aware of those fees either, and they were going to start trying to find out before they went for visits.
Experts tell us these kinds of fees are top of mind for many legislators at this very moment.
But I know a number of states are going to continue to pursue prohibiting facility fees, and there are some states that we're watching closely, Ohio being one of them.
Rob has watched too, seeing his riding days hung up for now. He wants medical systems to take a pause as well.
You do give compassionate care on the front line level. We want to see it from the corporate side.
Now, UH resent us its original statement saying, in part, the fees allow it to provide the highest quality care. It says it's been working with Beth Davis. However, UH ignored all our questions about Rob and his concerns.
Well, Jonathan, thanks so much for the update. I'm sure there will be another. Thanks for that.
You bet.